Each year, approximately 1,500 to 2,000 Malaysians suffer from heart attacks. About 50% of them die before reaching the hospital. When the heart stops, death is virtually certain if no resuscitation is given within the first 10 minutes of cardiac arrest. During this short period, the victim's life depends on the quick responses of bystanders. If you are a bystander in this situation, performing cardiopulmonary resuscitation or CPR can increase the victim's chances of surviving. This video will teach you the basics, life-saving steps of performing CPR and using an automated external defibrillator for an adult victim of cardiorespiratory arrest. On discovering a collapsed victim, you must first ensure that the scene is safe. Look for nearby hazards and ensure that you, the victim, and the environment in which you are providing care is safe. If danger is present, take steps to remove the hazards or remove the victim to a safe place before providing care. If no immediate danger to you or the victim is present, avoid moving the victim, which could precipitate injuries such as spinal injuries. Next, establish whether the victim is conscious or unconscious. Do this by gently shaking the victim's shoulders and asking, "Hey, are you okay?" Or give commands such as, "Sir, open your eyes." When doing this, be sure to speak loud and clear to the victim. If the victim doesn't move, speak, blink, or otherwise react, you must activate the emergency response system. If there are other bystanders present, shout for help and get that person to call 999 or your local emergency number. Next, return to the victim and scan the victim's chest for movements to determine if he or she is breathing. If the victim is not breathing or not breathing normally, for example, only gasping, you should assume that no breathing is present and begin the steps of CPR. Make sure the scene is safe before approaching the victim. Tap and gently shake the victim's shoulder and ask, "Hey, are you okay?" or "Sir, open your eyes." If the victim doesn't respond, get help. Send someone to get help or call 999 and get an AED. Return to the victim and scan the victim's chest for any movement which indicates spontaneous breathing for no less than 5 seconds but no longer than 10. If the victim is not breathing or is only gasping, begin the steps of CPR. CPR comprises of two main critical components: chest compression, which pumps the blood to vital organs in the body, and breathing, which pushes air and oxygen into a victim's lungs. Chest compression is the act of pushing on the victim's chest, which compresses the victim's heart between the breastbone and the spine against the hard, firm surface. It is worthy to note that rescuers often do not push hard enough because they are afraid of hurting the victim. However, ineffective chest compressions do not adequately force blood out from the heart to supply vital organs with much needed oxygen and nutrients. Although an injury is unlikely when compressions are performed correctly, treatable injuries, for instance rib fractures, outweigh the risk of certain death from ill-performed chest compressions. In single rescuer CPR, 30 chest compressions are interposed with 2 breaths for victims of all ages. This gives rise to a compression ventilation ratio of 30 to 2. The rescuer would perform 5 continuous cycles of 30 chest compressions and 2 breaths to complete a set of CPR before checking the victim. When giving chest compressions to an adult victim, it is important to remember the following key points. Push hard and push fast to a depth of at least 2 inches or 5 centimeters and at a rate of at least 100 to 120 compressions per minute. Allow the chest to completely recoil after each compression by taking your weight off the victim's chest and minimizing interruptions between compressions to no more than 10 seconds to provide breaths. We will now demonstrate the steps of performing chest compressions. Position yourself at the victim's side. Make sure the victim is lying on his back on a firm, flat surface. Move clothes out of the way to expose the victim's chest. Place the heel of one hand in the center of the victim's bare chest between the nipples over the lower half of the breastbone. Put the heel of your other hand on top of the first. Straighten your arms, lock your elbows, position your shoulders directly over your hands. Deliver 30 chest compressions. Push hard and fast. Press down at least 2 inches or 5 centimeters with each compression. For each compression, make sure you push straight down on the victim's breastbone. Deliver compressions in a smooth fashion at a rate of 100 to 120 compressions per minute. At the end of each compression, make sure you allow the chest to completely recoil or come back to its normal position. Minimize interruptions between cycles of chest compressions. Before providing breaths, you will first need to open the airway. In an unconscious victim, the tongue falls back and blocks the airway. Performing a simple maneuver to open the airway can displace the tongue and provide a patent airway passage. There are two methods for opening the airway: the head tilt chin lift maneuver or the jaw thrust maneuver without head extension, which is used only if you suspect a head or neck injury. We will now demonstrate the methods for opening the airway using the head tilt chin lift maneuver. Place one hand on the victim's forehead and the fingers of the other hand under the bony part of the lower jaw near the chin. Avoid pressing against the soft tissue under the neck or chin. Tilt the head back by pushing down on the forehead and lift the jaw to bring the chin forward. Giving breaths pushes air and oxygen into the victim's lungs to be transported in circulating blood. Your breaths need to make the victim's chest rise. Chest rise indicates that an adequate volume of air has entered into the victim's lungs. Each breath should be delivered over 1 second. Breaths when delivered too forcefully or too quickly causes the air to enter into the victim's stomach instead of the victim's lungs, causing gastric inflation. To give breath, you can either perform mouth-to-mouth breathing or use a barrier device. Although there is very little chance that you will catch a disease from providing mouth-to-mouth breaths, barrier devices such as face shields or a pocket mask can greatly reduce that risk. When you do not have a barrier device and you are unsure of the status of the victim, it is reasonable for you to provide hands-only CPR, where the rescuer gives continuous cycles of 30 chest compressions without pausing to deliver breaths. We will now demonstrate the steps for giving breaths. While holding the airway open, pinch the victim's nostrils close. Take a breath, then seal the victim's mouth completely with your mouth. Give 2 slow breaths, with each breath lasting 1 second. Watch for chest rise as you deliver each breath. To use a pocket mask, Remove the pocket mask from the container. Expand the folded mask and assemble the mouthpiece to the connector. Place the mask over the victim's mouth and nose using the bridge of the nose as a guide. Tilt the head and lift the chin while pressing the mask firmly against the victim's face. It is important to make an airtight seal between the victim's face and the mask. Give 2 slow breaths, with each breath lasting 1 second. Watch for chest rise as you deliver each breath.